This is Weight Matters. We're talking about weight loss in older adults. My guest for today's show is Dr. Edunjobi. You're welcome to the program, sir.
Thank you very much.
Okay. Now, if you take a look at, a family album and you look at an individual from maybe when he was in his late teens, in his 20s, and then you fast forward to him being in his 40s, what you see is maybe an increase in the size of the head or even the face. The waist has thickened over the years. The person has maybe added 2, 3 dress sizes. It seems as if as we grow older, we tend to add weight. Why is this so?
Thank you very much. I think, I hope you're not talking about the male gender alone.
No.
It seems,
No.
This applies to both
Yes, definitely.
Now, when you look at what you just described about the albums and coming back to the age of 40 and above, we're looking at it from two perspectives now. There's a good part and the other part. Now, the good part, which I wouldn't really call good on the long run, is the fact that we've been exposed to a lot of westernization and technologies. Now, westernization affects even our diets now. There are lots of people who don't eat what we used to eat in those days. I wouldn't say we, there are older people more than myself who have eaten directly from the farm, produce and all that. But these days, we eat all the foods that are prepared, garnished with salt, with fat, with oil and all that. So westernization of that is one of the reasons why that is in the first instance. Okay.
In our environment, it's, it seems to be a way of life, when you have some money for you to become more sedentary. Are there symptoms that people can take note of, that will tell them that something is going wrong with your system? Things that could begin to happen to an individual? Well,
there are lots of things we need to look at here. It's a multi-organ thing now.
Okay.
It is the commonest thing amongst people who seem to be sedentary or gaining weight now. Okay. They'll have, joint pains.
Yes.
These are, everything boils down to the fact that the weight-bearing joint will carry all the loads. Talking about the hips, the knees, and the ankles. So that's where it starts from. Person will complain of joint pains. It could be from the hip, the knees, the ankles. Then as time goes on, there could be obvious deformities. That's the common K and the bow legs, called varus and valgus deformities.
Now, for an individual who is already experiencing this and who is looking at how they can begin to lose weight, what will you advise them?
Well, thank you for that question. The best approach, really, it's a multidisciplinary approach. Okay. Because if I advise you to see just any medical practitioner, it's not something such a person alone could handle. Yes. There's a role of the nutritionist in this. There's a role of the physiotherapist in this. And if someone has access to a gym, this physical fitness exercises. So the doctor will see you at the outset and will advise you that all these people combined together would have a role. Now that depends on how far this has hidden into the individual. Wow. Now it depends on which other doctor. There are lots of subspecialties in medicine. If it affects the heart, the doctors in you may refer you to the cardiologist. If it's affecting the brain, for all you care, the person could come down with stroke. Those are one of the risk factors. All these sedentary lifestyles, you have your slowed metabolism, the blood is not moving fast, there's, stagnancy in the vessels. We call something a thrombus. It will just stay there because you're not active. Then the moment you move, it will embolize. It could go to the heart, it could go to the brain, it could go to the kidney. And these are complications that will come ultimately. We have talked about a number of things today that can help us as we grow older to ensure that we are not overweight and that we maintain a healthy weight. And also the things that we can do to help, members of our family that are in their 60s and upwards, and how to ensure that they're healthy and they spend a lot more time with us. Doctor's orders today is that as you grow older, ensure that you go for your medical checkups as at when due,
and that you have healthy habits that you make a part of your lifestyle, which includes exercising and eating healthy. Thank you so very much for being with us today, and have a wonderful week.